A C-section can be planned, or it can happen suddenly in an emergency. In both cases, doctors perform a precise, step-by-step surgery to safely deliver a baby. But why would someone need a C-section in the first place? And what makes an emergency C-section different? Welcome to CleanHealth. In this video, we'll break down how a C-section is performed step by step, why it might be necessary, what causes emergency C-sections, and how many C-sections are considered safe. A C-section is done when a vaginal birth may not be safe for the mother or the baby. Common reasons include the baby is in an unusual position, like breech labor is not progressing properly, the baby is too large to pass safely, there are problems with the placenta, or the baby shows signs of distress. Sometimes these are known ahead of time, so the C-section is planned. A planned C-section is scheduled in advance. Doctors prepare everything ahead of time and the procedure is calm and controlled. An emergency C-section is different. It happens when something suddenly goes wrong during labor, such as the baby's heart rate drops, the umbilical cord is compressed, there is heavy bleeding, or labor becomes dangerous. In these cases, speed is critical. The goal is to deliver the baby as quickly and safely as possible. Before the surgery begins, the patient is placed in a sterile operating environment. Regional anesthesia is given to numb the lower body. The abdominal area is cleaned and sterile drapes are placed. The surgeon makes a horizontal incision across the lower abdomen. This goes through the skin and fat layers, creating a controlled entry point. The abdominal muscles are gently separated, not cut. This reduces damage and helps recovery. The surgical team carefully moves layer by layer toward the uterus. A small incision is made in the uterus. This opening is slowly widened. At this point, the baby is just behind this final layer. The surgeon gently lifts the baby out through the opening. The umbilical cord is clamped and cut. Within moments, the baby is delivered. The placenta is removed from the uterus. The team checks to ensure everything is clear. The uterus is stitched closed. The muscle layers are returned to position. Finally, the skin is closed using sutures or staples. Each layer is repaired carefully to support healing. There is no exact universal limit, but most doctors say that multiple C-sections increase risk over time. Each surgery can lead to more scar tissue, which may raise the chance of complications in future pregnancies. Many people safely have 2 to 3 C-sections. Some have more, but it depends on the individual case and medical history. This is something doctors monitor very closely. A C-section is more than just a quick procedure. It's a carefully controlled surgery used when safety becomes the priority. Whether planned or emergency, every step is designed to protect both mother and baby. Follow CleanHealth for simple, clear medical explanations. And if you want to understand how your body works, there's always more to learn.